Welcome to this episode of CGTN Special COVID-19 Frontline. So since March, CGTN has been hosting similar online consultations joined by both doctors here in Wuhan, the epicenter of the coronavirus outbreak here in China, as well as the doctors from around the world to share their expertise and experience so that we can have a better understanding of this virus and we can fight a better battle against the virus. And I am CGTN's Xu Xingchen, and here today, and we're joined by Drs. Cao Wei and Xiao Meng from Peking Union Medical College Hospital, and they have been sent here since the beginning of this outbreak to help doctors in Wuhan, especially for those critically ill patients. And also on the other side of this conference call that we have Dr. Liang Cheng-kit in Singapore and Dr. Shabir Mahdi from South Africa. And we're also expecting another doctor from India, Dr. Vigas Maria, to join us later throughout the session. But let's start off with both doctors from Peking Union Medical College Hospital, just because today is actually the third day of the Wuhan lockdown measure lifted. But we still see the battle in the ICU, intensive care units, continue. According to local data, across Hubei province, where Wuhan is the provincial capital, we still have over 300 COVID-19 patients hospitalized, and over 100 of them, in critical condition. So, what's the situation like in your ward here in Wuhan?
Yeah, we're still caring patients in the critical care unit. We still have about 10 to 15 patients in the intensive care unit, and we'll keep on working for caring for them. And all together, there are still over, just as you said, 300 cases left in Wuhan. And we are also facing with imported cases reported every day. So basically, although the lifted of the city lockdown has been lifted, we are still facing challenges as regarding this pandemic. Yeah.
Yes. And Dr. Xiao, do you have anything to add? Not really. Okay, so for our foreign doctors, Dr. Kit and Dr. Mahdi, any questions? Probably started with Dr. Kit.
Hi, good evening. I'm Chun Kit. I'm Dr. Leong from Singapore. So I'm very privileged to join this forum. Very thankful that we are all sharing our expertise here and our knowledge. One of the key things that I would like all to know, or at least for ourselves, is that in Singapore we are still experiencing a rise in the number of cases. I'm actually a family physician in training, and I'm also trained in public health, which is in disease control as well. Now, so I would like to know that even as our city is being affected wave after wave, this is probably our fourth wave of cases that is rising. Is there something that you can share with us in a very quick way, what we can see in terms of the wave of infection in your city? Do you see, in other words, my question is, do you see many waves of infection in the city since the beginning of the outbreak, which we in Singapore, we're actually experiencing it right now?
Yeah, it may be different from areas to areas, but as far as Wuhan is concerned, I don't think we have experienced a wave at wave. We have an outbreak that started since January, and then gradually subsides in March. All the cases are mostly domestic cases, and currently the newly onset cases are nearly around zero each day, and we are still experiencing sporadic cases. That is 1 or 2 per day from imported cases or leftovers, but we haven't seen there's a trend of a second wave right now in Wuhan.
Right. Now, continuing from my question on the wave, is there any difference in the presentation of the infection, say, compared from the beginning of the outbreak, as compared to, say, middle of the outbreak and currently the situation? Is there a difference in the disease presentation?
It's not very obvious as regarding the differences of presentation. Also, because of the treatment and control measures are actually improving all the time. So maybe patients are getting a better care or a relatively longer stay after they have been admitted to hospital. But I don't think we can see an obvious trend of the virus changing at this time.
Right, yeah. The reason why I asked that is because we have noticed that at the beginning of the outbreak, we sort of knew that fever, cough, and breathlessness seems to be the early symptoms. And if we trace back to the outbreak at Daegu in Korea, we find that one of the key, whether it's called pneumonic feature at that time, is actually anosmia, which is the loss of taste and smell. So we do seem to see a little bit of that currently in our latest wave of infection. We are not sure whether there's a new development or is it something that we missed out earlier in the early infections. Do you see that loss of anosmia as one of those that you see in China as well?
That is not very common symptoms here in China. No, not very frequently. I agree that your question is very interesting as regarding if there's any variants of the virus. But actually, different presentation based on different times and areas may have multiple factors that have influenced on it. For example, the different population at different areas may have different biological background or immunological background that may have some impact on the clinical presentations. And also, the immune functions of the individual will have an influence on the clinical presentation. For those immune compromised, some will present a mild course, but some will become exaggerated very quickly. So that may only be that is not only determined by the virus itself, but certainly we can see more cases of the world to determine it.
And regarding the question for wave of disease, actually, because in China, especially in Wuhan, Hubei province, we have very strict strategy for quarantine all the persons in the city and in the province. So at least in Hubei province, we do not expect another wave of disease coming in the future. But of course, in China, we are also facing the challenging of import case from other countries, so which raise up the concerns for another wave of outbreak maybe, but actually China government and all the institutions are collaborating together to deal with this new circumstance.
I'm sorry to interrupt real quick because we just got connected with Dr. Vega's Maria from New Delhi in India. And can you hear us fine, Dr. Maria?
Yeah, I can hear you.
Great.
Nice to meet you all.
Yes, great. So for our online viewers, if you have any questions, you can make a comment with hashtag my opinion on COVID-19 and we'll try to answer some of them during today's episode. And then let's move on to Dr. Shabir Mahdi from South Africa. Do you have any questions for doctors here in Wuhan?
So good day to you, and thank you for the invite. So I guess one of the big questions that's facing many countries, especially lower middle income countries, is what sort of strategy to actually use in terms of containing the virus. And many countries have gone into lockdown, as an example, South Africa, as well as India. So the question to you is, how feasible do you think a lockdown is in terms of being able to contain a virus in low-income settings, where there's high density of people, where the conditions are very different from, example, what exists in Wuhan? Do you think a lockdown strategy is a correct strategy for these countries to be adopting? And what is it of the lockdown strategy in Wuhan that you ascribe to being successful in terms of containing the virus? Particularly, as an example, to what extent did you scale up testing to identify infectious cases and put them into isolation, and then do follow-ups of their close contacts and put them into quarantine. So it would be useful to hear from you exactly what your experience was in terms of how the lockdown was implemented, and essentially whether it would be feasible in other settings that are much more dense and where there's much less restrictions in terms, or there's less ability to monitor the movement of people.
Yeah, thank you for the question. It is a very interesting question. Actually, as you said, the procedures we are taking should be based on the situations of the country where you are living, and determining on multiple situations and factors you should consider. The basic rule here is actually to control the infected patients, control the infection source, and cut the transmission routes. So in order to realize that, I think different countries can choose different measures to realize in his own country. For example, in China, we did it in this way, just as you got to know from the news. The quarantine the lockdown of several cities has begun since late January, and then for China, it seems possible that we sacrifice a few months of economic development and try to keep the health of basic health needs of the people. And people can stay at home following the government's and nation's guide, and people will take different measures to protect themselves. Also, the government and community has done a lot to provide the necessities during this time. For example, all the medical workers and resources from all of the country have been sent to Wuhan and Hubei to help to fight the epidemic here in the single province, which is needed because after the lockdown, the medical resources within the city or the province is very limited and will soon go out if there's no supplies moving on. And then the community also worked a lot to help the individuals or the inhabitants here to keep their daily life. There are a lot of volunteers and organizations to help deliver the necessities for the life, and also different levels of quarantine and observation are taken. For example, there is a community-based organization to keep a close eye on all the people here living in this community or district, to keep their records of temperature, to see if there's someone who has been going in or going out the district, to keep a record of that. And then we have the cabin hospital, shelter hospital, to admit those who have been infected or potentially being infected, but with very little symptoms or mild symptoms. And they will be kept there, be observed for if there is any worsening of the symptoms. And then we have medical centers, basically for the severe or critically ill patients to meet their healthcare needs. So different levels will serve different functions. And I wouldn't say one single point here or one single measure works the most efficient, but these all about together works out the strategy against the virus. I know that many countries and areas have followed the strategy of lockdown, but doesn't seem to work very well, just as we did in our country. I should say there are many reasons that may impact the actual effect of this strategy, the people, the nation, and the culture. So yeah, basically we feel that although lockdown strategy turned out to be very effective in our country, but different countries and areas may have different choices based on their situations.
So if I can follow up from that, how important was the acceleration of testing or the rate of testing in going out to actually look for symptomatic individuals? Did you actively go out house to house to find individuals that might have been symptomatic and then tested those individuals to identify those infectious cases? Or was it more passive, where you wanted people to come forward to you to be tested?
Okay, so actually we also gone through a very hard time, especially in early February, because actually at that time the number of medical staffs in Wuhan are not sufficient to support this. And I want to start from another story. You may see a recent published paper in Nature. it mentioned that actually for the SARS-CoV-2, for this new coronavirus, the viral load reached to peak level even before the symptom is on site. And we can easily get a positive culture from upper respiratory samples. That is totally different to SARS, which means that even before one patient have symptoms on site, they already may infect many other persons. So which means that detection and even lockdown and cutting off the transmission route is important. And just as Dr. Cao mentioned, actually since early February, the government in Wuhan have great efforts in the community efforts in asking community staffs just go one family to identify anyone who was suspicious to have the infection disease. And for the whole China government, we have a rule for early detection, or early identification, early isolation, and early treatment. This is essential. There is, of course, no single answer for this question. It's just a comprehensive measure or efforts in dealing with the disease.
So I think you raise important points in terms of the asymptomatic and pre-symptomatic individuals and the possibility of them being transmitters. But it would be interesting to know from you, as an example, so Wuhan has got a population of roughly about 60 million, if I'm not mistaken. How many tests were being done each day during the lockdown period, just as a measure to sort of find out how aggressive you are with testing? As an example, in South Korea, they tested roughly about one person for every 150 of the population when they went to the extensive social distancing. In Wuhan, what was your testing rate in the population, approximately per day, as an example?
Okay, as far as I know, since early February, the testing capacity in Wuhan city have already reached over 10,000 tests per day in the city. And since late February, as the newly identified cases are decreasing, but actually the capacity for testing are still increasing. So in the single city, we can manage at least 20,000 testing per day for the whole city's patients, because many of them are still need repeated testing, including their criteria for discharge. Yeah, so the repeat testing and the testing capacity is, of course, essential for dealing with COVID-19.
And Dr. Madi,
I think that's one of So that's one of the challenges that exists in many of the other countries that have implemented lockdowns, especially on the African continent and probably in India as well, is that they don't actually have the capabilities and the capacity to be testing at that rate. And for me, that would be one of the most important elements of a lockdown, to identify the infectious cases, because in absence of that, you're pretty much just expecting a rebound after the lockdown is actually lifted. So I think that's something that needs to be emphasized, the importance of testing when implementing a lockdown. A lockdown on its own is not going to get rid of the virus.
Yeah.
And another essential thing is that actually, also from publication and our own experience, actually, after this around 1 week or 10 days of symptom onset, it's very hard to get a positive molecular screening test again. So which means if a patient were delayed in molecular testing, then it's very hard to get a positive support from the molecular testing result. So also, of course, we introduce the serological tests in supplement with molecular testing. But as far as we know here, the situation here, we just quarantine the suspicious patients and keep testing and know whether they are confirmed cases or exclude them.
I think that's definitely a very important crucial link. Just as the WHO Director General, Dr. Tedros, has said that we cannot fight a fire blindfolded. We need to do a lot more tests. But Dr. Madi, that we're going to come back to you later. But now let's turn to Dr. Viegas. Maria, because you're from India, and Dr. Madi also touched on situation, about India. So any questions for our doctors here in Wuhan?
Yeah, thanks for allowing me in this meet. And, at the moment, you are all aware that there's a total lockdown in India. And, this has certainly helped us, not only for the social distancing, but also in creating the infrastructure, and also on some way in decreasing the it may help in decreasing the epidemic curve. And so now all hospitals, they have started doing designating the hospitals. So earlier all hospitals were asked to have some beds for COVID and all, but now they have designated COVID hospitals in in every city. So that's what has happened on so this is helping us to contain the COVID virus. Another thing is that this lockdown period has certainly keep the people at home, and they are not. And this is being strictly followed at the moment. What I am seeing is that only people for essential services are being allowed. So nobody is allowed to come out of home. So this is certainly help us decreasing the number of the patients. The other thing which I was want to ask is that it's very easy for a patient coming with the respiratory symptoms, having a fever, and what we have, what the government has made a guideline that anybody having a fever, then they immediately refer that patient to a fever clinic, and we ascertain the respiratory symptoms. If they're having a respiratory symptom, on the basis of that, they categorize as having a mild, moderate, or severe. And then they went to a COVID hospital or a COVID centers and all. So my question, number one is, for example, those, we are seeing many patients from other specialities. They're coming with no fever. For example, they are admitting under cardiology, or they are admitting under, different specialty like nephrology, or different specialty like GI surgery. And then, because they're also having a fever, and then they're later on finding that it's a COVID positive. But by the time it may, result in a lot of, contacts being created. So how much atypical presentation was common in, Wuhan and China? And what are the measures were taken, to prevent such situations in those patients who are not respiratory predominantly, but from other specialties? My second question is, about, the testing. At the moment we started with the RT-PCR, and we do not have at the moment a NAT testing, and antibody testing has been started. Now they have started doing antibody testing in the hotspots, and for example, in the containment area, and in the places where we have a cluster of cases. So which do you think is the most important component of this testing? And because at the moment we have, as per the government data, we have around more than 6,000 cases. And the other question regarding the treatment part, and treatment as well as the prophylaxis. Prophylaxis, if we said that HCQS is we have been started HCQS for the healthcare workers. So did you also give HCQS to the healthcare workers in China? And what was given to the healthcare workers apart from obviously PPE, any medications or any prophylaxis was started? And the question regarding the treatment, so what do you think was the treatment which actually worked specifically in moderate to severe category of patients? Thank you.
Okay. Can I just clarify, the first question is about to meet different medical needs of fever patients and those patients coming for other reasons of medical care?
Yeah, my first question is that predominantly we are doing, for example, seeking fever as one of the most common symptoms in case of viral illness. So it is very easy to isolate these patients. But those who are coming from other specialties like cardiology, GI surgery, but they're also now having the symptoms suggestive of COVID, and they're also found to be positive for COVID. So how many such things you found in Wuhan, China?
So my suggestion would be that first to take standard protective procedures for the healthcare workers, for the physicians and nurses, if they're working to treat patients, wear surgical masks when possible, just to take for granted that the patient is unknown situation, and then still we have tried to tell what the situation of the patient is. For example, if the place is an epicenter of COVID-19, then you have to pay attention to every patient that's coming in to your hospital and try to figure out if he or she had any close contact with confirmed patients or suspicious patients in the past 2 weeks, or if you can make a brief history taking about where he or she has gone in the past 2 weeks, any symptoms, and if needed, he or she could send to receive a chest X-ray or CT scan just to rule out the possibility if the patient is going to be hospitalized for other medical needs. And if the patient has turned out some symptoms other than fever, for example, upper respiratory symptoms or diarrhea, gastrointestinal symptoms, you should also be cautious whether the patient can be a potential carrier or asymptomatic or infected patients of COVID-19. But other than the epicenter of the COVID-19, for example, like in other places in China, where the cases of COVID-19 is sporadic, then it is most important for the medical workers to wear standard PPEs when treating every patient, just to keep themselves safe. Yeah.
Okay.
And for the question about the testing, as I just mentioned, actually, of course, the RT-PCR is still regarded as the gold standard for diagnosis of the disease. But in China, especially in an early period of time, we experience up to 50% of false negatives. This is related to, as I mentioned, the course of the disease, because as the duration of prolonged duration since symptom onset, the sensitivity of PCR just decreased as the workload decreased. And also, of course, it's related to the type of specimen you used, including upper respiratory samples or lower respiratory samples, and also the way you collect the samples. Because I see some videos from foreign countries, they just collect a swab in a very superficial part of your nose. But we need to collect the samples from nasopharyngeal or oropharyngeal part. But of course, in the frontier line, in fever clinics, especially when the medical staff are wearing PPE, it's very hard to collect the samples in a correct way. So this is a reason why we not recommend for a single time or one-time test. We have to repeated test them. And of course, the antibody test, because previously we also see that there are false positives for the antibody test, especially for the IgM. But it's just a comprehensive diagnosis, because in China, we also, in all the general hospitals, we have a very fast turnaround time for the CT scan, even within 30 minutes. So for any suspicious patients, we will put them on the list for CT scan first, and then blood routine test and simple laboratory test. Then determine whether some of them will receive the molecular testing and antibody testing, and then make a comprehensive clinical decision for those patients, whether they are confirmed one or need further follow-ups or can be excluded. But especially in the epidemic cities, we have to make a decision in a very careful way.
Yeah, for the third question of the prophylaxis, no, we are not currently using any prophylaxis for the medical workers who are treating COVID-19 patients. All we use is to provide standard PPEs, enough rest, and also try to make the medical workers in a good mood. And we have over 40,000 medical workers sending to Wuhan and Hubei province from all of the country. And just by using that, without prophylaxis, we don't have one single medical workers got infected during their work. So a correct way of protection the medical workers themselves would be enough to keep them from being infected. And for the treatment part, unfortunately, actually, I think many of you you may also know that we don't have any antivirals with definite efficacy that can work on this virus. So we may try the antivirals recommended also in our nation's guidelines, but it seems that the antivirals can only take effect at the initial phase of the disease. Currently, we had a feeling after treating so many patients that although we are mainly treating the critically ill patients, that the disease course can actually be divided into several phases. The first week, patients usually present with very mild symptoms, low-grade fever, and if the patient is going to deteriorate, the time point was about the second week to the third week. Then patient began to have clinical deterioration with infiltration of the bilateral lung, and also the elevation of inflammatory markers. So in the first week, when the patient have very mild symptoms, the only thing we do is to supportive care and also to observe carefully how the patient is going. And then on the second week, if there is clinical deterioration starts, something may be done to stop this deterioration. It could be steroids or sometimes intravenous immunoglobulins and other choices. But there is no, I don't think there is an agreement on as to what is going to be used at this point. But this is certainly a critical point when you can stop the progression of the disease. Once the patient has entered into the clinical care, critically ill phase and entered the ICU, the mortality is very high. Different ICUs has above the same level mortality, around 60 to 70% of mortality. And in that phase, no magic bullets will work for the patient. All the patient needs is comprehensive treatment that all patients may need it in ICU. But in COVID-19 patients, early intubation, early intensive ventilation, and also prone position when in ICU department will have been determined to be effective for these patients. But then what you need is most comprehensive support.
Yeah, just to add on, a lot of people are saying about use of lopinavir, ritonavir, and other, HCQS, azithromycin, sort of treatment. Not an actual, not a specific treatment, but just, to give these kind of patients, moderate patient or severe patients. So do you think they have any effect like HCQS, azithromycin, lopinavir, ritonavir, and many other things like, it has been told like tocilizumab?
The treatment of lopinavir has been tested in at least three controlled trials, although the results are slightly different from each other. And at least one or two trials came out to the conclusion that there may be no obvious effect of lopinavir, ritonavir as to treating COVID-19. But one trial came out that in mild patients, this drug may help to reduce the symptoms and shorten the duration of fevers. However, based on these results of the clinical trials, I think it is still hard to determine whether the drug is taking some actions during this process. Also, we have two randomized clinical trials that has been carried out in China here for the remdesivir, the drug of hope. One is in mild or moderate patients, and the other is in critically ill patients. And the results of these two trials are anticipated in mid-April. And I think at that time, we may be able to tell if any antivirals can be effective during this disease.
And about HCQS?
Sorry?
Hydroxychloroquine, and about hydroxychloroquine, anything?
I personally don't have the experience of using hydroxychloroquine here. Also, you may read that there is a clinical trial using that. Also have some efficacy in reducing the symptoms. But I don't think the chloroquine can reduce the mortality rate. I think we still need more studies to determine whether this is a promising drug in the COVID-19, because the already published one actually is not non-randomized and a very small scale treatment. And also there are actually some individuals taking chloroquine have unfavorable outcomes that are not listed in the analysis. So we basically need more more studies to see that. I know many countries is taking clinical trials, try to testing the efficacy of hydroxychloroquine or chloroquine. Hopefully, yeah. Because in China, we don't have enough patients now to go through these medical trials, clinical trials. but the results may be anticipated in other countries other than China.
Anyway, in China, our experience for patients in phase 1 or phase 2 that were with mild symptoms, anything you want to give it a try, including traditional Chinese medicine. But when they turn into severe or critical conditions, there were no magic bullets. The only thing we can do is comprehensive support, life support for the patients.
So definitely we're still in the seek of a effective medicine to treat COVID-19 or a vaccine. But as Dr. Chow said, that protection is very important and early intervention to prevent patients from worsening their conditions is very important. That we have to point this out, like tens of thousands of people are also watching this session on YouTube or Facebook. They can be just regular people and they have been posting their questions. So Jason Chan asked on YouTube, it's a very simple question, but I think it's a good reminder for people around the world. He asked first, like mouth, nose, and ear, what is the area that it can be most easiest for the virus to penetrate and get people infected?
The areas that the virus can penetrate the human beings is mostly the facial areas, the upper respiratory tract. So anything that can get into that tract through any ways can be possible. For example, through the nostrils, through the mouth, and also things that can have attached on your mouth and your nostrils. But what I want to say to the ordinary people is that the infection through mucosa, for example, through the eye, is not something that you need to worry in daily life. It only happens in medical circumstances when the aerosol is generated by the medical procedures. So basically, in daily life, you don't have to worry about that you can get infected through the eye. So just to protect your nose and the mouth area is enough.
So basically, they can wear a mask, and that's sufficient.
Yeah, but
to
please
correctly wear a mask.
Yeah, please wear a mask.
Okay, definitely, and a surgical mask will be
that's
fine,
enough
and
for
not the N95 respirator.
Yeah, the surgical
Not
mask.
necessary for daily life.
Okay. And also from Jason Chan, he asked, and I'm curious as well, can this virus survive and transmit via like food such as like chicken meat?
The oral fecal transmission route is not being identified in this virus. Although we know that the virus can be shedding through the fecal samples or through the, but the transmission is basically still by touching, close touching. For example, your hand have touched what you have left over on other surfaces, and then accidentally touch your tongue or mouth. So this is your hands is a mediator of infection. You're not just got infected by eating this food or digesting this food. So it is not a classic oral fecal transmission way. So we don't have to worry about food, but you have to worry about your hand hygiene before you want to eat the food. And so just to try to make the food clean as usual. We don't want to eat any dirty foods at daily times, but just to double check that your hand is clean before you want to eat something. Yeah.
So can I understand, like for like chicken meat, I got it raw from the supermarket. As long as I cook it well,
Yeah.
it won't have the possibility to transmit the virus. And of course, my hands are clean.
Yeah, absolutely.
So let's go to another round of questions from our doctors from overseas. And Dr. Liang, do you have more questions?
Right. I was thinking that in Singapore, one of the reasons why we have not seen a very big rise, right, except for the beginning, and we are still hovering and controlling fairly well, is the strategy of contact tracing.
Yeah.
We actually do a lot of contact tracing. So in short, we are talking about active case finding and testing. In fact, one of the questions we ask ourselves now that we have more cases, we should, or whether we should do even a blanket sweep of the people around us. So in China, at the time when you had many cases, I understand that you also do not do a big sweep across the community, but how do you select your patients to do the swab at the community in that sense at that time.
community 里边选择什么样人做试剂？
So the question is, do you select the patients when they come into the hospital, or do you go to the community to find cases to test them? And if you go down to the community to test them, what are your criteria? Who do you choose and pick to swab?
Okay, so there's also two different stories in different cities or regions. In the common area, just like our mother hospital in Beijing, actually we only do screening for suspicious patients who come to fever clinics in the hospital because there are not so many cases. But in Wuhan, the community staff just go one family by one family and then find anyone who have suspicious symptoms, including fever or cough, and then we'll send them to a designated hotel in the early period of time. And actually, since middle February, as we have cabin hospitals here, so all suspicious patients will sent to the cabin hospital and receive testing there. All the patients, all suspicious. We do not want to left anyone who is suspicious to be infected in the community or at home. So since the third or fourth version of our national China national guidelines, we do not recommend family isolation furthermore. So all patients need to be quarantined in a certain area, and then we can do repeat testing for them.
Right. So I remember you mentioned, and of course we have read reports about asymptomatic patients spreading the virus even before the incubation period is officially over. Now, by doing so, did you pick up those cases from the community, or did you pick up because of retrospective case finding?
Yeah, because now China government already initiate the report for number of asymptomatic patients every day in the nation, but the majority of them are identified as close contacts for the confirmed cases. Actually, we also have a strict rule for the epidemiology history tracing for the confirmed cases. And in our guidelines, we require any confirmed cases need to finish their epidemiology history investigation within 24 hours, within 1 day since they were identified. And then all the close contacts will be quarantined and tested. And now the majority of asymptomatic cases are identified from these close contacts. So this is one good way to identify who were suspicious or could infect other people and reduce the risk for other population.
Right. So follow on with that. Being close contact, I would think that most of us healthcare workers are also considered close contacts because we are really in the environment. Do you have any strategy or any program that you routinely check among the healthcare workers for, say, swapping, not just the symptomatic ones, but among those working in the high-risk area, for example?
Yeah, because at least in Wuhan, because we are national medical teams coming here, so including those healthcare staff, because there are nearly 40 hospitals becoming designated hospital for COVID-19 patients only in the Wuhan. So healthcare staffs working in the hospital do not get back home. They just live in a certain hotel every day. And then at least in our medical team, we do screening, including swabs and antibody tests. This is one reason is keep all our medical staff are safe. Another thing is to reduce their mental burden, because especially when we initially face the infectious disease, we do not know much about the virus. So many medical staff are a little bit afraid of whether we will get infected by the virus, even we are asymptomatic. But we screened our medical staff, and until now we do not have anyone have a positive report for both molecular screening and antibody test.
So I just want to have follow on one question, which is slightly different. Which is when you mentioned about, in fact, both of you mentioned about the mental state of the workers, of the healthcare workers. What kind of strategy do you have in place to mitigate the mental stress on the healthcare workers?
First, knowledge. To tell them, we have the actually different generations of health workers in the same team, and a part of them have experienced the 2003 SARS epidemic. So those are very experienced doctors or nurses, can teach those younger doctors and nurses how to protect themselves from this disease. And also, just as Dr. Shaw said, we not only test the swabs of the medical workers, we also test the environment we were working in, the intensive care unit, the tables, the doors, and the bedside of the patient, to see if any of the samples will turn positive. And it turned out they were all negative. That will grow the confidence of the medical workers that they won't get infected through the exposure. And also, we to make a reasonable shift of the nurses and doctors. For example, the doctors will work every 6 hours, and the shifts of the nurses are 4 hours, to make them have enough time for rest and to keep a good mood, and also communicate with them, like group discussion when necessary, to make themselves feel like home. These are all measures that we use to make the medical workers be keeping in a good mood and mental status. And I know that the Tongji Hospital, where we are worked here in Wuhan, they also have a assistant team of psychiatry physicians that will provide consultation or help whenever necessary. But as far as I know, we never caught them for that. So, yeah.
Because we also have strong support from our mother hospital.
Yeah.
They provide us enough equipment, enough PPE, and also consultation for any personal things, including anything happen in our family. We do not worry anything going wrong at home. So we have a very big support from our mother hospital, from the local hospital, local people, and all the people in China.
So definitely, I think protections and mental support are very essential, because to keep our medical workers in check. And I have to say, medical workers are the last defense between this virus and humanity. And thank you so much, Mr. Leong. But because of the time's sake, I need to move on to Dr. Maddy. Do you have more questions for Dr. Cao and Dr. Xiao?
So I guess one of the big challenges that's been faced in many resource-constrained countries is what to prioritize in preparation for a wave of COVID cases. And in particular, it would be good to get insight from you in terms of how do you balance preparing in relation to what is required at healthcare facilities. And in particularly, how important is it for countries at this stage to sort of increase their capacity for ICU facilities, for ventilators, as compared to other more basic essentials, such as oxygen supply and PPE for the staff. And sort of a follow-on to that is, when it comes to ventilation, can you perhaps give us some idea in terms of what was the case fatality risk for individuals that were ventilated? Because obviously if the case fatality risk is very high, it's sort of deprioritize that, if not achieving much by putting people onto ventilators.
就是估计就是脱机率、死亡率吧，你先说。
还有包括它是否要提高就是我们的 ICU 的这个 capacity。
Yeah, that's a tough question, especially at the beginning of the epidemic. The city of Wuhan and Hubei province has gone through the period, just as you mentioned, and many areas of countries may be experiencing now. So at the initial phase, we are experiencing some shortage of medical devices and facilities. But then after the lockdown of the city, and medical devices and facilities and medical workers have been sent to Wuhan from various different places of China, the situation has been greatly improved. also noticing that there is a shortage of such supplies. Nearly all the places other than Hubei and Wuhan are putting their full efforts to produce them. So the daily production of masks and goggles are increasing tremendously over the first few days after the lockdown. So basically to have a promising supply of medical devices. And then the hospital allocation actually is a very huge problem in Wuhan, because the city was not, any city wouldn't be set up for such public health emergencies. So what we've done is that we have certain numbers of hospitals that have been designated COVID-19 hospitals. And also we set up new cabin hospitals and shelter hospitals for those with mild or asymptomatic infected patients. And those hospitals, I think there should be over 20 shelter hospitals in Wuhan, could have a large capacity of admitting these asymptomatic or mild symptomatic patients. And those designated medical centers will mainly focus on the severe or critically ill patients. In many hospitals, the ICU department is emergently set up based on the modification of previously existing wards. So there are some difficulties as regarding the oxygen supply, even the pressure of the oxygen canals, which wouldn't be a problem before. So the local government and the people did a lot to help to meet these supplies. But finally, we got to manage that. So, yeah, you have to weigh a lot when in this situation to try to do the most adequate or proper measures. We cannot take the standards everywhere. Just we have to suit the situations at that time. Yeah. So what's the second question? The mortality.
Do you have any idea in terms of what percentage of people that were put onto ventilators survived?
About 20 to 30%.
Survived. So 80% died.
70%.
70% died.
Yeah.
And I think that's important because many countries are sort of trying to increase ICU capacity. And I think that information that the majority of people that will end up on a ventilator, not surprisingly, because of the ARDS, won't actually survive. And it's important in terms of prioritization as to where we should be allocating limited resources.
But I want to mention that early invasive ventilation can, according to our experience, can help improve the survival rate. Because this is a general data we experienced in this past 2 months. But as I mentioned, in early period of time, because a lot of patients do not receive invasive ventilation in a proper time, so the death rate are quite high. But if we can, because actually the most awful thing is that the exhausted of medical resources. If we cannot control the baseline number of newly infected cases, anyway, 20% of them will turn into critical conditions, and a lot of them do need invasive ventilations. So do early intervention as early as possible. This is our experience.
And actually, that's also I learned from other doctors. Because I've been here in Wuhan since the beginning of the lockdown as well, and I've been speaking to other doctors, and they said like early intervention can somewhat help with the survival rate. But let's now move on to Dr. Maria. Any more questions from your end? I think you're on mute.
Yeah.
We can hear you now.
I just want to know, at the moment, the Indian government is very, very aggressive, and they're doing aggressive contact tracing. I mean, even containing the area where there are more than 3-4 cases, and then going each and every home. So that is being done, but there is a lot of anxiety among the common people as well as among the healthcare workers. So anything you want to say to the common people, we're facing this situation? And my second thing is what should be the future strategies of the world, we as a whole world, that we should do something can be done so that something should not happen in this future, to this, to all people, to humanity.
那个全世界怎么合作？
To the common people, ordinary people, it is very important to prevent yourself from getting the disease. That's the only suggestion and recommendations to ordinary people. And then you need to tell the common people how to protect themselves. In China, usually we'll tell the people that the 2 ways to protect yourself. One is keep your hand hygiene, to wash your hands when necessary after you have touched on certain things. And before you want to touch yourself, you have to wash your hair with water and soap, or with and also you have to protect. The second way is to wear masks in China. If you are in a crowded area and you need to be keeping very close to each other, not what we call the social distancing, for example, more than 1 or 2 meters, you have to be close with each other, then wear a mask to make sure that you won't get exposed to the possible droplets that potentially containing virus. So these are the 2 ways that the general public can keep themselves healthy. And also, during the epidemic, we recommend the common people not to come out frequently, just to stay home. That's a recommendation of the government to the people, especially in February, to try to stay at home, to decrease the time you spend with other people outside. And this will efficiently prevent yourself from close contacting with other people. Just through these ways. But you have to make everyone know this, to make them know that this is effective way to keep yourself from infection. That's basically the answer to the first question.
There's a lot of anxiety among common people regarding this. So do you take care of mental health regarding common people? Apart from healthcare workers, mental health is taken care of.
I think for the ordinary people, the most important thing of mental health, to keep them mentally healthy, is to let them know the situations correctly. So what is going on in this country, how many cases we have been diagnosed, and how many patients are still within treatment, how many being discharged. And these numbers will help the public, ordinary people to get calmed down. And also, we have generated multiple ways of medical services, for example, the online consultation. Although during the lockdown or quarantine time, many hospitals have reduced their time of seeing outpatient, but online consultation is going on day and night. So many physicians are working in front of the computer to provide professional knowledge to those who might be afraid of this situation and who feel that I might got some symptoms and I'm not sure if I had COVID-19. So many of the medical requests are actually solved by online doctors. So this is another way that the health professions can provide the ordinary people with support.
And for your second question, in China, we always say that one world, one dream, because now we live on the same planet. We only have one Earth. So what we can do now towards this world pandemic is collaboration. Because anyway, in China, we are very close to the fully success for beating the first wave of the disease. But so I think the most important thing is we do not have time to blaming others. We have to collaborate, including in the just like what we are doing now. We want to tell you the truth. We want to share our experience. Some maybe useful experience, but some we are still eager to find the correct answer together. And we also have to collaborate in further research, for example, development of vaccines and finding maybe potential effective antivirals together, because now we do not have many cases here, but the research is have great progress in China. So I think the most important thing is the global collaboration in fighting against the COVID-19.
Yeah.
So Devin, because as we know, COVID-19 has turned into a pandemic since a month ago, declared by the WHO, and multiple health officials from around the world, even including the National Institute of Health from the United States, and a vaccine needs global efforts, and to tackle with to really defeat these enemy needs a global effort. And I hope like sessions like this online consultation that has been bringing doctors from overseas closer to doctors here in Wuhan to share their experience. I hope this serves a platform that can help us to better understand this virus. But because we're running out of time today, and thanks for all of your participation in this session, and thank you so much for Dr. Liang from Singapore, and Dr. Maddie from South Africa, and Dr. Vegas Maria from New Delhi, India. And thanks for your time. And I have to say this, because the 76 days of lockdown has lifted here in Wuhan, but doctors from like Peking Union Medical College Hospital are still here. The battle is still here, and they might need to stay longer for another 10 days or weeks. We don't know yet, because the battle is not over yet. But anyways, please stay tuned on CGTN. Follow us on our Facebook or YouTube or Twitter. Download our mobile application, and stay tuned for similar consultation sessions like this that we are going to bring you a better understanding of this virus. And CGTN will continue to be here in Wuhan, the epicenter of the coronavirus here in China, for the foreseeable future. Thanks for watching.
Yeah, I just want to say one thing, I mean,
Yes.
you guys are amazing, and I think we should clap for you. What you did, in Wuhan, I think everybody should that,
Thank you so
Thank
much.
you.
Well done. Well done.